Did you know that over 50% of men above the age of 50 experience some degree of erectile dysfunction, and that millions are silently turning to a little pill that promises to restore their youth, but could actually be putting their hearts and brains at serious risk? Tadalafil, also known as the weekend pill, has become a silent hope for aging men worldwide. It's praised for its long duration and subtle effect. But what if I told you that using it regularly could trigger health issues far beyond the bedroom? Let me ask you something. Do you really understand what Tadalafil is doing inside your body every time you take it? And more importantly, are you aware of the long-term consequences that no one talks about? Not even your doctor? In this video, you're going to discover the real benefits, hidden risks, medical truths, and dangerous myths surrounding Tadalafil use after the age of 50. And around 70% into this video, I'll reveal a new scientific finding that could completely change the way you view this medication. So stay with me till the end, because what you'll learn today might not only improve your quality of life, but potentially save it. As men enter their 50s and beyond, a silent shift begins in the body, one that affects more than just physical strength or energy. Testosterone levels begin to drop, blood vessels lose elasticity, and circulation slows down. The result? An increasing number of men face the frustrating and often embarrassing challenge of erectile dysfunction. According to recent studies, over 50% of men aged 50 to 70 experience some form of ED, whether mild, moderate, or severe. But here's the catch. For many of them, this is not just about sex. It's about identity, confidence, and control over their own bodies. Tadalafil, originally developed to treat erectile dysfunction, has become one of the most sought-after medications by men in this age group. Why? Because unlike other ED medications, Tadalafil lasts longer, up to 36 hours, and allows for more spontaneity without the pressure of perfect timing. But the demand goes deeper. Many men aren't just looking for improved sexual performance. They're seeking a solution to reclaim their masculinity, intimacy, and even their marriages. But here's the twist. This quiet movement toward Tadalafil isn't being discussed openly. It's happening behind closed doors, often without full medical guidance, and almost always without understanding the long-term impact. And as we'll explore next, Tadalafil might be doing more to your body than you realize, in ways both good and potentially dangerous. Coming up, what exactly is Tadalafil, and what is it doing inside your body once you swallow that pill? The answer might surprise you. Tadalafil belongs to a class of medications called PDE5 inhibitors, short for phosphodiesterase type 5. Sounds complex, right? Let's simplify. When a man becomes sexually aroused, the blood vessels in the penis need to relax and expand so blood can flow in and create an erection. This process is controlled by a molecule called cGMP. But here's the catch. The body also produces an enzyme, PDE5, that breaks down cGMP and stops the erection. Tadalafil works by blocking PDE5, allowing cGMP to stay active longer. The result? Improved and sustained blood flow to the penis and a stronger, more reliable erection. But here's where Tadalafil stands out from other medications like sildenafil, Viagra. Its duration. Tadalafil can stay in your system for up to 36 hours, earning it the nickname the weekend pill. This longer window of activity allows for more flexibility and reduces performance pressure, but there's more going on beneath the surface. Tadalafil doesn't just affect the penis. It also has systemic effects, especially on smooth muscle tissues found in the prostate, bladder, lungs, and blood vessels. That's why it's sometimes prescribed for conditions like benign prostatic hyperplasia, BPH, helping ease urinary symptoms, pulmonary hypertension, reducing pressure in lung arteries, Raynaud's phenomenon, improving blood flow to extremities. But here's something most people don't know. Tadalafil might also improve blood flow to the brain and reduce inflammation in blood vessels, something researchers are only beginning to understand. Still, any drug that affects the vascular system so powerfully is not without risk, especially for men over 50 who may already be taking medications for high blood pressure, heart disease, or diabetes. And this leads us to a crucial point. What are the real benefits of taking Tadalafil regularly after 50, and are they worth the potential risks? That's exactly what we'll uncover in the next chapter. The 4 major benefits of Tadalafil beyond erections. Most people associate Tadalafil strictly with sexual performance. But what if I told you its benefits go far beyond the bedroom, and that some of them could significantly improve your overall health after 50? Let's explore 4 of the most surprising and scientifically backed benefits of Tadalafil. 1. Improves prostate health. One of the most common issues men face as they age is benign prostatic hyperplasia, BPH, an enlarged prostate. This condition causes frequent urination, weak urine flow, and nighttime urgency that disrupts sleep. Tadalafil has been approved to treat BPH symptoms by relaxing smooth muscle in the prostate and bladder, making it easier to urinate. That means fewer nighttime trips to the bathroom and better quality of life. 2. Enhances cardiovascular circulation. Tadalafil was originally studied for heart-related conditions. Its ability to dilate blood vessels improves blood flow not just to the penis, but throughout the body, including the coronary arteries and the brain. Preliminary research suggests that in some cases, it may help lower blood pressure, reduce arterial stiffness, and even improve vascular function in people with early signs of heart disease. But remember, this benefit comes with caution, especially for those already on nitrate medications. We'll talk more about that in the risks chapter. 3. Boosts exercise. Performance and endurance athletes have started paying attention to Tadalafil for its effect on oxygen delivery and muscle recovery. While not officially approved for this purpose, some studies have found that men using Tadalafil may experience improved stamina during physical activity, especially those with underlying cardiovascular limitations. For men over 50, this can translate into better workouts, more energy, and even improved metabolic health. 4. Supports mental well-being and confidence. Let's not forget the psychological impact. Sexual dysfunction can deeply affect a man's self-esteem, relationships, and mental health. By restoring confidence in this area, Tadalafil often contributes to a reduction in anxiety and depressive symptoms related to performance. Many users report feeling younger, more connected to their partners, and more in control of their lives, benefits that go well beyond the physical. But here's the catch. These benefits only apply when the drug is used correctly and under proper supervision, because as we'll see next, the very same mechanisms that make Tadalafil powerful can also make it dangerous, especially when ignored. Next up, the hidden risks when Tadalafil becomes dangerous. While Tadalafil offers real benefits, especially for men over 50, it's not without serious risks, particularly when used without proper medical guidance. Let's break down the most critical dangers that men in this age group need to understand. 1. Cardiovascular complications. Tadalafil lowers blood pressure by relaxing blood vessels. That may sound like a good thing, and in some cases it is. But if you're already on nitrate medications for chest pain or heart disease, combining them with Tadalafil can lead to a sudden, dangerous drop in blood pressure, potentially resulting in fainting, heart attack, stroke, even death in extreme cases. For men with undiagnosed arrhythmias, severe aortic stenosis, or other hidden cardiac issues, this sudden drop in pressure can be catastrophic. 2. Vision and hearing loss. Though rare, some men have experienced sudden loss of vision or hearing after taking PDE5 inhibitors like Tadalafil. These are typically linked to problems with blood flow to the optic or auditory nerve. If you ever notice blurred vision, a blue tinge in your sight, or ringing in your ears after taking the medication, stop immediately and seek medical help. 3. Interactions with other medications. This is one of the most overlooked risks. Tadalafil can interact with alpha blockers, used for high blood pressure or prostate issues, certain antifungals and antibiotics, HIV medications, other blood pressure drugs. These interactions can amplify side effects, lead to dangerous blood pressure changes, or reduce the effectiveness of one or both drugs. 4. Overuse and psychological dependence. Because Tadalafil can be taken daily or on demand, some men begin using it habitually, even when it's not medically necessary. Over time, this can create a psychological dependence, where a man believes he can't perform without it, even if his body is still capable. This emotional reliance can lead to anxiety, avoidance of intimacy, and erosion of natural sexual confidence. 5. Masking underlying health issues. Perhaps the most dangerous risk of all is that Tadalafil can cover up deeper medical problems, such as diabetes, early signs of cardiovascular disease, hormonal imbalances, depression. Instead of addressing the root cause, men may simply take a pill, ignoring a warning signal from the body. So now you might be wondering, if the risks are this serious, how do I know if Tadalafil is safe for me? That's exactly what we'll answer in the next chapter. Who should definitely not take Tadalafil? Tadalafil isn't for everyone, and in some cases, taking it could be downright dangerous. Whether you're considering it for the first time or have already been using it, it's critical to understand who should absolutely avoid this medication. Here are the major red flags. 1. Men taking nitrates for chest pain or heart disease. This is non-negotiable. If you're on nitrate medications like nitroglycerin, whether daily or occasionally, combining them with Tadalafil can cause a life-threatening drop in blood pressure. The two drugs intensify each other's effects, and this interaction is one of the most well-documented medical emergencies involving ED medications. Even if your nitrate use is as needed, you should never take Tadalafil within 48 hours of a nitrate dose. 2. Men with uncontrolled high or low blood pressure. If your blood pressure is above 170/100ths mmHg or below 90/50ths mmHg, you're at significantly higher risk of complications from Tadalafil. In these ranges, the drug can trigger dizziness, fainting, or cardiovascular collapse. 3. Men with recent heart attack or stroke. If you've had a heart attack within the last 90 days, stroke within the last 6 months, unstable angina, chest pain at rest, Tadalafil could increase the strain on your cardiovascular system during sexual activity, which is already a physical stressor. In these cases, the risk far outweighs the benefit. 4. Men with severe liver or kidney impairment. Tadalafil is metabolized by the liver and excreted by the kidneys. If these organs aren't functioning properly, the drug can build up to toxic levels, increasing side effects and danger. In such cases, dosage adjustments or complete avoidance are usually required. 5. Men with known allergies to Tadalafil or similar drugs. It may seem obvious, but it's often overlooked. If you've ever had swelling, rash, breathing difficulty, or chest pain after taking Tadalafil, sildenafil, or other PDE5 inhibitors, you should avoid them entirely. And one more crucial note, even if you don't fall into these categories, it doesn't mean you're in the clear. That's why it's essential to speak with a qualified healthcare provider before starting, especially if you're over 50 and taking other medications. Coming up next, we'll dive into one of the most common questions men ask. Should I take Tadalafil only when I need it, or every day? Once men over 50 begin using Tadalafil, one of the most common dilemmas arises. Should I take it only before sex, or is it better and safer to use it every day? Let's break down the difference between the two approaches and which one might suit your health, lifestyle, and relationship best. Option 1, on-demand use, as needed. This is the classic approach, taking Tadalafil only 30 to 60 minutes before sexual activity. Pros: lower overall exposure to the drug, fewer pills equal sign, potentially fewer side effects, more control over when and how you take it, ideal for men who have sex less frequently. Cons: requires planning or timing, can reduce spontaneity, may be less effective if taken on a full stomach or with alcohol, can cause anxiety if you're unsure about when the effect will kick in. On-demand dosing typically uses 10 milligrams or 20 milligrams depending on the individual response. Option 2, daily low-dose use. Maintenance. This method involves taking a low dose, 2.5 milligrams or 5 milligrams once a day, regardless of planned activity. Pros: constant blood levels equal sign spontaneity, anytime helpful for men in long-term relationships. Also treats urinary symptoms of BPH, prostate enlargement, may improve endothelial function over time. Cons: higher long-term exposure to the drug, potential for gradual tolerance or side effects. Costlier due to daily use. Daily use is especially popular among men dealing with both ED and urinary issues. making it a dual-purpose treatment. So, which is better? The answer depends on your sexual frequency, health status, and other medications, comfort with planning versus spontaneity, prostate or urinary symptoms. Important tip: if you're not sure how your body reacts to Tadalafil, it's often better to start with on-demand use and then discuss daily dosing with your doctor if needed. But here's a word of caution. No matter which strategy you choose, there are several common mistakes men over 50 make when using Tadalafil, and they could be sabotaging its effectiveness or putting themselves at risk. That's exactly what we'll cover in the next chapter. The most common Tadalafil mistakes men over 50 make and how to avoid them. Even though Tadalafil is a well-tolerated medication, misusing it can not only reduce its effectiveness, it can put your health at serious risk. Let's go through the most frequent and avoidable mistakes men over 50 make when taking Tadalafil and what you should do instead. 1. Taking it with a heavy or fatty meal. Tadalafil isn't as sensitive to food as some other ED drugs, but a large, high-fat meal can still delay its absorption, making it slower to take effect. Tip: take it on an empty stomach or after a light meal if you're using it on demand, especially if timing matters. 2. Mixing with alcohol. Alcohol is a vasodilator, just like Tadalafil. Combining the two can cause dizziness, headaches, flushing, dangerous blood pressure drops. Excessive drinking can also impair sexual performance on its own, defeating the whole purpose. Tip: limit yourself to 1-2 drinks max when using Tadalafil, or better yet, avoid alcohol altogether on that day. 3. Guessing the dosage without medical advice. Many men self-prescribe 10 milligrams or 20 milligrams thinking more is better, but higher doses don't always lead to better results and can increase side effects like back pain, headaches, muscle aches, indigestion. Tip: always start at the lowest effective dose and let your doctor guide any adjustments. 4. Not waiting long enough before giving up. Some men try Tadalafil once or twice, don't see immediate results, and decide it doesn't work. But here's the truth. For many, it takes 3 to 6 attempts to find the right conditions, timing, and mindset for it to work effectively, especially when performance anxiety or underlying health issues are present. Tip: be patient. Try in relaxed conditions and give your body time to adapt. 5. Treating it like a magic fix. Tadalafil can support performance, but it can't fix poor cardiovascular health, low testosterone, unmanaged diabetes, chronic stress, or relationship problems. Tip: see it as part of a bigger lifestyle strategy, not a one-pill solution. Diet, exercise, sleep, mental health, all matter. Next up, we'll answer the big question every man eventually asks. Is long-term use of Tadalafil safe, or are there hidden dangers ahead? You've seen the benefits. You've heard the risks. But now comes the ultimate question. What happens if I keep taking Tadalafil for months, or even years? Let's look at what the most recent science tells us, and what every man over 50 needs to consider before making Tadalafil a long-term part of his life. What we know from clinical studies. Most studies on Tadalafil focus on short to medium-term use, typically 12 weeks to 6 months. However, there are a growing number of trials tracking patients who use it daily for 1-2 years or longer. Here's what's been found. No significant organ damage has been reported in long-term users when used at proper doses. Side effects like headache, flushing, nasal congestion, or back pain often decrease over time as the body adapts. Daily use can lead to sustained improvement in erectile function, prostate symptoms, and even vascular health markers. In fact, some evidence suggests that long-term Tadalafil may help preserve endothelial function, which is a critical factor in preventing cardiovascular disease. But that doesn't mean it's risk-free. There are still unknowns. For example, no long-term studies exist for 5+ years of continuous use. The impact of Tadalafil on hormones, neurological health, or cancer risk over decades is not well understood. Men who self-medicate without proper screening are at greater risk of missing underlying conditions like prostate cancer or silent heart disease. Additionally, using Tadalafil long-term without addressing root causes, such as obesity, inactivity, diabetes, or low testosterone, can delay necessary treatment and create false confidence. The bottom line: yes, Tadalafil can be safe for long-term use in healthy men, especially when taken under medical supervision, at the right dose, and as part of a broader health strategy. But it's not meant to be used endlessly without reassessment. Annual checkups, heart evaluations, and prostate screenings become even more important if you're on continuous therapy. And now, as promised, here's the surprising scientific discovery I teased at the beginning of this video. Recent studies are exploring how daily low-dose Tadalafil may actually help reverse early-stage arterial stiffness, one of the leading causes of high blood pressure and cardiovascular aging. If confirmed, this could mean that in the right context, Tadalafil isn't just treating symptoms. It may be slowing down vascular aging itself. Let's recap the truth, without hype and without fear. Tadalafil is not just a pill for sexual performance. It's a vascular medication with effects that reach the heart, brain, prostate, and emotional well-being. For many men over 50, it offers a path back to confidence, intimacy, and freedom. But like any powerful tool, it must be used wisely. What you've learned today. Why so many men over 50 are turning to Tadalafil, often silently. How the drug works in your body and how it can benefit much more than your sex life. The serious risks you must not ignore, especially if you're taking heart or blood pressure medications. Who should absolutely avoid Tadalafil and why? How to decide between daily and on-demand use based on your lifestyle and health. The most common mistakes men make with this medication and how to stay safe. What science says about long-term use, including a promising discovery about its role in vascular aging. Doctor-backed advice you can use today: never self-medicate. Always consult a doctor, especially if you're over 50 and taking other medications. Start low, go slow. Begin with the lowest effective dose and monitor your body's response. Treat the root, not just the symptom. Use Tadalafil as a support, not a crutch. Focus on your overall health. Stay alert for side effects. Anything unusual, from chest pain to blurry vision, should not be ignored. Reevaluate regularly. Don't stay on it indefinitely without checkups. Your body changes. Your treatment should too. Now, I want to hear from you. Have you ever tried Tadalafil? What was your experience like? And what advice would you give to other men considering it? Drop your story in the comments. You never know who you might help. If you found this video helpful, give it a like. Share it with a friend, a brother, or someone who needs this information. And subscribe for more no-nonsense, science-backed health content for men over 50. Until then, take care of your health. And don't just treat symptoms. Understand your body. Own your choices. Live stronger.